Okay, Wendell?
Yes.
You're still here. Okay.
I'm here.
Just very quickly, the difference between the 138%, let's say the poverty line in the United States is, what is it, probably in the neighborhood of $20,000 a year?
It is. I apologize. I don't know exactly what it is, and I'm not in a place where I can call it up right now. But it's,
Right.
Let's say that. Yeah.
So if it's $20,000 a year, you're looking at 138% would be about a third more than that. So that would be about 128,000 a year, or excuse me, about $28,000 a year, something like that. Now, up to that point, you get subsidies. Does that mean that they pay for all of your insurance? That your health insurance is completely free?
It's on a sliding scale. It depends on just how close you are to that 138%. The higher up, the more income you make, the less subsidy you'll qualify for. So those who are the poorest among us will get the most subsidy, and to the point that many people who are really close to that line will get the vast majority of the premiums paid.
So if you're at or below the poverty level, do you get free insurance?
It depends. Well, if you're at or below, you will have coverage from in the Medicaid program. However, because some states are not expanding, it really complicates some things. So probably not free for people who would otherwise get it in the states that are not expanding, but they will be eligible for subsidies, and probably very close to being free. But I would not go so far as to say that it'll be without any cost to them if they are having to buy coverage on the exchange.
Right. They would, though, get the tax credits. Right?
Yes, they'd get the tax credits, and they would be substantial to the point of paying the vast majority of premiums if the closer they are to the federal poverty level.
So this 400%, that's a completely different thing than the 138%. 400% of the poverty level is like $80,000 a year. So if you're making up to $80,000 a year, you still can get some help from Uncle Sam to buy your health insurance?
If you are a family, yeah. For individuals, I think it's and again, I'm not sure what the figures are, and if for the next time we're on the show, I can be sure that I have numbers in front of me. But I think for an individual, it's you can get subsidies up to about $47,000, and for a family, $94,000. Those are not exact figures, but subsidies are available to people who make close to what the median household income in this country is, which is almost $50,000. But for individuals, it's about $47,000. For families, it's around $90,000.
Okay, and those subsidies are what? $5 a month, $500 a month, all of the cost of the insurance, 10%, 20%? How does that slide? Any sense of that yet?
Well, it depends on what your actual income is and what the sliding scale is along that spectrum, and you will get some help. And I'm just not in a position right now to say precisely how substantial that help is.
Does that vary from state to state?
No, that will not vary from state to state.
Okay, so that's a federal program.
Yeah,
all right. Stick around, Wendell. We're going to rejoin our commercial stations here. We'll continue our conversation with Wendell Potter, health insurance industry whistleblower, the author of Deadly Spin, website wendellpotter.com.